Hi everyone, it's Dr. Dave, and I am coming to you with information on a fascinating study that I just read. It was called the PISA study, P-E-S-A. I'll show you the link here. And basically what it was a study out of Spain. They looked at 546 predominantly men, age 50, Caucasian. And what they wanted to know was, are there certain risk factors associated with a concept called cerebral hypoperfusion? Cerebral hypoperfusion, which its name suggests, is decreased blood flow measured by PET scan in the brain. So isn't that fascinating? You know, we talk about decreased blood flow in the heart, causing heart attacks, in the legs, causing peripheral arterial disease. But what about the brain? And I'm not talking strokes, I'm talking lack of blood flow to the brain. So lack of blood flow to the brain, called cerebral hypoperfusion, is really a marker of brain health. So when people are studied for cerebral hypoperfusion, if there is cerebral hypoperfusion or less blood flow to the brain, that is a marker of future dementia. Now, it's not necessarily causative, but it's suggestive of somebody's risk of developing dementia in the future. So what's fascinating about this study is they looked at people in their 50s, average age 50, and they looked at a couple of factors that may be associated with hypoperfusion or decreased blood flow in the brain. And what they found was high blood pressure or multiple cardiovascular risk factors called a Framingham score, or, very fascinating, carotid plaque, cholesterol building up in the carotid arteries. These are arteries that go essentially from the heart to the brain. If you have cholesterol building up in these arteries, that's a risk factor for dementia through cerebral hypoperfusion. So this was a very complicated, sophisticated study. But to summarize briefly, high blood pressure, lots of risk factors for cardiovascular disease or vascular disease, and carotid disease are risk factors for dementia through cerebral hypoperfusion. Okay guys, just some food for thought, really fascinating. Remember, take care of yourselves, because when you take care of yourself and you decrease your risk factors, not only do you reduce the risk of having heart disease and heart attacks, but maybe dementia. Until next time, this is Dr. Dave.